Tonight for you in Medical Rounds, a brand new procedure for patients with esophageal cancer is offering some very promising results. Dr. Stefan Kachala, a thoracic surgeon at the Hartford Healthcare Cancer Institute, was the first surgeon in the state to perform a certain robotic procedure. Dr. Kachala is joining us live right now from Hartford Hospital to tell us more about this latest surgical approach, which we will talk about in a moment. Dr. Kachala, thank you very much for being here with us.
Thank you. Mark, good evening.
Thank you. Well, let me ask you, first of all, doctor, what are some of the symptoms associated with esophageal cancer and what causes this type of cancer?
The symptoms associated with esophageal cancer are typically those we sometimes associate with things like reflux disease. It can be severe indigestion that doesn't go away, as well as an atypical or dull kind of chest pain. Finally, some patients complain of difficulty swallowing, and most worrisome are those patients who experience weight loss without trying. Risk factors for esophageal cancer are those we kind of expect, such as smoking and excessive alcohol consumption, but also a diet that is poor in fruits and vegetables and other antioxidants have been associated with esophageal cancer.
Certainly interesting, and I'm sure you would recommend anyone see a doctor if they have any of those symptoms anytime. You performed the first robotic procedure on March 1st using a Da Vinci robotic system. Doctor, tell us more about how it works and tell me the name of it, because I purposely didn't say it because I was afraid I would say it wrong.
The procedure was called an esophagectomy, and the conduct of a robotic-assisted approach we performed at Hartford Hospital is similar to the traditional open approach. First, through the abdomen, the esophageal tumor is dissected free of the diaphragm, and next the stomach is dissected free as well and turned into a tube or new conduit, which will become the new esophagus. After the abdominal proportion is completed, the patients turn on their left side, and through the right chest, 2/3 of the esophagus are excised, and the tubularized stomach becomes the new esophagus.
Quickly, doctor, tell me some of the benefits of robotic surgery for patients with esophageal cancer.
Yes, the robotic-assisted approach is associated with 3 benefits that I'm excited to provide for my patients. The first one is less pain. Second is less bleeding, and finally there's a more rapid recovery for the patient back to their pre-surgical state.
All right, well, that's certainly good to hear. We do want to ask you, you will be hosting a community education class, this is in West Hartford, on April 10th about a different topic, lung cancer. What will you be talking about there?
So I really want to demystify lung cancer for our patients. I've been working on this for some time, and the goals will be first to let patients know what the risk factors are, as most patients already do, but also what screening studies are available to them. And finally, what new minimally invasive techniques are there to diagnose and also provide definitive therapy for lung cancer.
All right, Dr. Stefan Kachala, thank you so much for joining us tonight. We certainly appreciate your time. As we mentioned, Dr. Kachala will be hosting a free community education class that is on April 10th in West Hartford called Surviving Lung Cancer, Screening, Treatment, and Prevention. Great information here. In the meantime, if you have a question about esophageal or even lung cancer, you can ask Dr. Kachala yourself right now during a live discussion on the Hartford Hospital Facebook page, beginning in just a few minutes.